Hello, my name's Brandon Ramacco, and today we're going to cover a special squat to help those with knee problems. In particular, those with clicking knees going upstairs, clicking knees with those doing squats, for example. Um, these clicking knees are often a result of a muscular imbalance in the quads that this special squat will try to remedy. Now in the quads for four muscles, there's a muscle on the outside of the quads and a muscle on the inside of the quads. And the muscle on the outside of the quads can basically be overutilized and the muscle on the inside can be underutilized. In fact, this muscle can waste away and become small. Basically, the brain's not using it anymore. And in fact, I often palpate and feel the muscles of my patients, and it's basically missing. Like it's almost like a hollow space where the muscle should be if this has gone on long enough and if it's bad enough. So yes, we want to target this muscle, we want to strengthen it if it's weak, and we definitely want the brain to engage this muscle more often. So that's going to be our goal. So let's check out these muscles now. Okay, so here we have vastus medialis, right here. And then here we have vastus lateralis, right here. So this is the outside one, this is the inside one. They should have similar muscular tone to them if everything's healthy. And similarly, on both sides, it should have similar tones. If you have one bad knee, you might want to check both. And if one is like, oh, it's hollow on one side, well, then you need this exercise. Now, I would encourage you to do this even if you've been avoiding squats, because that's what happened to me. I had these knee problems. I couldn't cycle because it would irritate my knee. I couldn't do squats. My knee would feel swollen and would lock and wouldn't work. So I avoided squats like the plague. And I avoided cycling any distance. I avoided stairs because my knee I knew it couldn't handle it. If I did too many stairs, I would feel it the next day. My knees would bother me. But when I went to school and I learned these exercises, I was like, okay, this is going to be the solution. And I really, truly pushed myself to do these, even though I'm like, oh, it's not going to work, it's not going to work. And it did work. Now I can cycle, I can do stairs, I can do squats, I can do lunges, and I don't really have any issues. So, the right solution for the right problem. When in doubt, consult a medical professional to get evaluated. Okay, now back here. Now, since this muscle is overworking, it can develop myofascial trigger points. So if you have myofascial trigger points, the treatment for that, I'm just going to go over it briefly because I've covered it in many videos now. You want ischemic compression. Once you find the myofascial trigger point, so any painful point that causes sort of spreading pain, you basically squish it, wait for the pain to drop, increase the pressure, squish it more, wait for the pain to drop, increase the pressure more. Now, I don't have any issues. I have good muscle tone on both sides, equal muscle tone. So I can't really find any really tender spots going through here. But if you have trouble, chances are you will find tender spots. Now, if you have tender spots here, and this is overworking, your IT band might be tight, and that's connected to the TFL muscle, the tensor fasciae lata muscles, and this might be overworking, so you might have myofascial trigger points, basically muscle knots up here that you can use ischemic compression in to get rid of those. So in that corner, and next to that, you have gluteus medius, which might be deactivated. I have another video about gluteus medius and an exercise to try to activate that muscle. The exercise is hip abduction, like this. So if you are finding myofascial trigger points up here, tender spots up here, and pain up here, chances are you need both this squat and the hip abduction exercise. Okay, so now we're going to get to the squat. So first I'll do a normal squat and then I'll do the special squat. It's okay for your knees to go over toes for this exercise. So here's a regular squat and here's the special squat. Now that probably looked identical. And to me, it did look identical, but what I was doing was not identical. So for the special squat, what I was trying to do was I was trying to screw my foot outwards. But because of the friction with the floor, my foot didn't go anywhere. That's why it looked the same. So here's the normal one. And I can even have my thumbs here to try to feel for that muscle. If I try to screw, again, my toes are going outwards, but they're not actually moving because of friction. I'm trying to screw the feet outwards, and I can feel that muscle engage. As soon as I feel the muscle engage, I can sort of stop at that point. I don't need to do a super deep squat and come back up. If you want to, you can. But you can just go until you start to feel that muscle engage and come back up. And that's the special squat. Now, when I was doing this, when I was trying to get rid of my knee pain, I found that this was less painful than a normal squat, although it did irritate my knee a little bit. And as I continued to do it, my knee just got better and better until it didn't get irritated anymore. So I wish you luck and have a good day. Cheers.